They are given either intravenously or subcutaneously. And the other newer agent which has come, you might have read, it's still experimental, molnupiravir. And that might change the landscape quite a bit, because this medication has been shown to reduce severity and mortality by 50%. So there is hope that we'll have an effective treatment in the form of antiviral treatment down the road.
That's for the mark, right? That's for the mark.
That's what the mark, yes, that's correct. And then deep breathing exercises always helps the lungs, right? Including if someone can do self-proning, okay? Basically flipping the patient, not to lie on the back, but lying on the tummy. Inpatient treatment is somewhat different than outpatient. Obviously, they are the sicker group of people. History, we do, then physical exam, blood tests. And blood tests basically is a collection of tests looking at the various inflammatory markers. Yeah, and they are named. They have got fancy names: C-reactive protein, D-dimer, ferritin, that kind of stuff. Basically, we'd like to find out how is the body responding to the viral infection. Okay, we always do X-ray because they're the sicker group of people. We need to have a look, and then obviously, is it COVID? Okay. Dr. Kumar mentioned it. So on the left, X-ray is normal. In the middle, you see there are some white patches, and those are not healthy. Okay. And extreme right is you'll appreciate the extreme right picture shows more white areas, means most of the lungs are affected, okay, and will be worried a lot, and that person might require a fair amount of oxygen. Now, this picture is a kind of lung section, okay. On the left, you see healthy lung, where the areas in the middle, these are the air sacs. Lungs are basically millions of small balloons which has a space in the middle where air goes in, and then at the edges of the air sacs we have blood vessels to take the oxygen which is here or give the carbon dioxide back. That's a healthy lung. And look at the right, where the lungs, the air sacs or air spaces are basically gone or very little, right? Breathing is a very effortless process. We breathe in and out so easily, almost we are not conscious of it. But when the lungs get to this stage, this is not easy, as if you have got several sandbags on your chest. That's not a very nice feeling. To expand the chest takes so much of effort, right? And believe me, the little oxygen your blood is getting, most of it is not going anywhere but to the chest, including the diaphragm, which is working really hard. So that's a very, very, very effort. It's quite an effort to breathe. For inpatient treatment, main thing is oxygen. We give fair amount of it, of various kinds. If we suspect there is bacterial infection, antibiotics. If it's an influenza season, there might be a role for specific antivirals. These are the conditions. COVID-19 is is a condition of where body makes a lot of, like we are more prone for thrombosis or blood clots. So we'll give certainly blood thinners. Continue to have, if they have underlying diabetes, heart failure, continue to treat those. Infection control. We have had outbreaks in all the hospitals, health sciences, several wards of St. Boniface, Grace Hospital, and other hospitals. And then the specific COVID-19 treatment. We have dexamethasone, which is a steroids, and several others fancy inhibitors, which are basically here to reduce the inflammation or body's reaction. Okay. Now I'll spend some time on dexamethasone. This is one of the easily available treatment from the study done in the United Kingdom. Helps people only if they are on oxygen. Higher the requirement of oxygen, the degree of benefit is more. Okay, easily available, but in India during the April and the month of May, I thought it was used without any second thoughts, just to prevent severe COVID-19. We have lots of people in India with diabetes or pre-diabetic condition. Indiscriminate use of dexamethasone, which can give high blood sugar, did not help. We got a lot of fungal infection, which is deadly also, mucormycosis, and that was not very wise thing. And mucormycosis also affected us in a bad way because COVID-19 does reduce our resistance to fight other infections. I'll move on. COVID-19 in children. Just a few points. COVID-19 in children. Children actually, most of the literature so far what we have is basically saying children have symptoms mild or asymptomatic, but exceptions are there obviously. So it does happen, but often they are kind of not affected in a big way. But I must point out another syndrome, multi-system inflammatory syndrome in children, okay? And this often comes few weeks after the original quote and unquote mild infection with a bang, where fever will be running on very high, 104, 105 degrees, going on for many days, weeks. But that is driven mostly by basically uninhibited inflammation, not by the virus itself, but it is unchecked inflammation. And that unchecked inflammation can cause a lot of problems for the organs. That includes heart, liver, skin, lot of vital organs, okay? So all emergency warning signs like stomach pain, difficulty in breathing, confusion, very fast heart rate, you know, all these are warning signs, and I think we should ask for help. Another thing we are realizing that a lot of people having long COVID-19 conditions of syndrome, okay, not the garden variety, few weeks of illness. Most of them who gets COVID-19 recover quickly, but several of them have symptoms going on for weeks to months. Another personal anecdote, my ward in charge at St. B, she got infected December 22nd, and she's not back even now, so which is October, right? Her main symptom was not a lot, just aches and pains, fever, no breathlessness. She was not even admitted. But now, who was earlier putting 14 hours, 15 hours because they have been mandated, right? You can't argue, they have to do 16 hours. Now cannot work more than half an hour or 1 hour, okay? And lots of them are affected in this way, like fatigue, trouble with breathing, cough, various aches and pains, loss of smell and taste, depression or anxiety, and dizziness and so forth. We don't quite understand this syndrome yet. What is driving it? What's the mechanism? We don't understand. And we have currently several clinics across the city. Few of them are at Health Sciences. Few of them are in Cardio 1 to address people who are having this set of symptoms, see how to help them. The reason we do not understand what is driving them limits what we can do for them other than supportive therapy. Now, is it unique to COVID-19? No. We have seen it sometimes even with other viral infections or other infections, like we see it after Lyme disease, we see it after influenza, or sometimes for no good reason, what you call chronic fatigue syndrome. We don't have a good handling on this condition. How I'm doing to time? Okay? Now, other group of people where we are worried, people with mental health. This is a terrible pandemic for all of us. So, what do we do to promote health and physical well-being? So, these are the couple of self-care strategies. First of all, make sure you get enough sleep. You keep up with your regular physical activities, eat healthy, avoid alcohol, drugs, limit your screen time, and relax and recharge as much as you can. So after you have taken care of your body, take care of your mind, keep your regular routine, limit exposure to news media, stay busy, all good stuff, yeah? Focus on positive thoughts, spiritual life for support, and set your priorities. Also important, connect with others. Avoid social isolations, make connections, do something for others, support a friend and a family member, but at the end, recognize what you are not able to cope. Is it that you are overwhelmed with anxiety, sadness, hopelessness, or other mental issues? And if you are feeling those, try to get some help. Need not be doctor, maybe your friend, maybe your counselor, psychiatrist, whoever, social worker. Now, if someone gets COVID-19 infection, what's the big point of getting vaccine? Right? Now, after a natural infection, we get immunity. What we do not know, how long that immunity lasts. Second thing, after natural infection, there is a risk of reinfection. And one study showed that the chances of reinfection actually more than twice. Okay? And each infection brings its own issue of risk of medical complication. And if we give you the vaccine after the natural infection, actually you mount a better response or more response of antibody, what we call hybrid immunity. But so that's certainly a reason to get vaccination even someone has got COVID-19 infection. And if someone gets convalescent plasma or monoclonal antibodies, you have to wait for 3 months before you get vaccinated. There are a lot of myths about COVID. Unfortunately, I'll list a few, like alcohol or chlorine spray. Okay? Spraying alcohol or chlorine on your body will not kill viruses. At the same time, it will harm our body parts. Neither drinking alcohol or taking garlic, right? What about ultraviolet disinfection lamp? Well, ultraviolet light is certainly useful as a disinfectant on the surfaces, but we should not use it on our hands or other areas of the body. There were blames on 5G mobile networks, which is not true. Various disinfectants. Well, disinfectants are good for surfaces, but not for your own body parts. What about supplements? Vitamin C, zinc, green tea, vitamin D. None of them have shown to improve or protect you from COVID or reduce the severity. Now, there are some papers now, vitamin D and COVID. Well, certainly if someone is low on vitamin D, you should take supplementation, but that nothing will change what it does to COVID-19. Pneumonia and flu vaccines, will it protect you from COVID-19? No. Saline nasal wash? No. Lot of people, at least in India, said do gargle. Okay, if someone has got COVID and you do gargling, well, you're dissipating viruses all around you. Bad stuff. Temperatures, either high or low, does not matter. COVID virus is a very, very sturdy virus. Ivermectin. Okay, ivermectin is a bad idea to treat COVID. Okay, New England Journal of Medicine recently published a communication where Oregon Poison Center got more calls what they get over a year, right? In just few days in August, and a lot of them took more ivermectin as a prevention to fight COVID. That's a bad stuff. Okay, I think I'm done. Now, COVID-19 was a terrible loss across the globe, and we lost a lot of people in India, including a lot of celebrities, right? Which we kind of we mourn their loss. And COVID-19 hit the globe, I would say, in a vacuum of any global leadership, other than just a handful of global leaders who gave us the lead. Okay? So, what is more important is more public awareness and more public support. Now that we do not have that kind of leaders, other than just a handful. I saw this yesterday and it hit me very hard that it's such a tragedy that in this situation now, we need a team from Sweden to raise the awareness or to kind of raise this alarm that we need public pressure not just summits. This was with regards to global warming. Okay? So, that's it.
Thank you.
Thank you. So speaking next, I will talk a little bit about the COVID vaccine in and of itself. Good. So let's talk about, Dr. Kumar already mentioned a little bit about vaccines already, so we won't talk about that too much. But basically, vaccines are ways to train your body to fight particular illnesses. It is not a treatment, but it is a prevention method. The COVID-19 vaccine cannot give you COVID. I think that's a very important point because there is some confusion about that out there. They help your body know what COVID is, so that should your body be exposed to COVID-19 in the future, as we all know, there's lots of incidents of it that's been discussed already, your body will be better equipped to fight that virus, so you don't end up in the ICU, or even worse, pass away, and or get the long COVID that we talked about earlier. The main vaccines available right now are the mRNA vaccines, both Pfizer vaccine and the Moderna vaccine. Side effects of the vaccine, as I've discussed already, are pain at the injection site, fever, malaise, tiredness overall that lasts between 1 to 2 days overall. These side effects are common and are quite normal. As mentioned before, these are mRNA vaccines, both the Pfizer and the Moderna. These types of vaccines have been studied for over 10 years, but they are new. They're new vaccines in terms of the type of method used. The way they work, though, is basically the same as other vaccines. They work to try and show your body what the virus is, so that your body can boost its immune system and fight the virus when it encounters it. These vaccine components are actually broken down in your body after the vaccine does its job of boosting your immune system. Important questions people ask are, can the mRNA vaccine give you COVID? And the answer is no, as we discussed. Can the mRNA vaccine change your DNA? The answer is no. How effective are these vaccines? Well, both vaccines we talked about so far are both 95% effective, but effective in terms of severe illness, in terms of ending up in the ICU and or death. It's important to stop COVID pandemic with these vaccines because, as discussed before, the more and more people have the vaccines, the less and less incidence of COVID there will be. Hence, eventually, the pandemic will end. As we talked about before, it decreases transmission, and importantly, you have to have all of the doses of the actual vaccine for it to be effective. 1 dose of the vaccine isn't sufficient. 2 doses currently are recommended and is sufficient. And booster doses are now becoming more prevalent as we recognize that as time goes on, the immunity from the vaccine starts to wane. So we'll talk about that later, but there is a good chance we'll need booster shots moving forward as the vaccine decreases its effectiveness over time. So an important point though is to remember that even with the vaccine, you can still get COVID-19. The vaccine's not 100% effective, and like I said, it's effective in only preventing death and severe illness. The main goal of the vaccine is to make sure that your actual sickness is much less significant. So you may end up with a cough, a runny nose, some fevers, but it will not lead to full-blown illness, which can lead to significant hospitalization and or ICU and death. Who can get the vaccine? Currently in Manitoba, anyone born before December 31st, 2009 is eligible for the vaccine. Currently, everyone under the age of 18 should get the Pfizer vaccine, and that's just based on clinical studies and approvals so far. Second doses should be given at least 28 days after the first dose. Children above age 5 will likely be allowed to get the vaccine in the next month or so as the approvals become available. Third doses are quite new. Right now, they're only available to certain people in the population. The third dose, just like the first 2 doses, is the same. There has been no modification of the actual vaccine due to Delta viruses. or different strains of the actual virus. It's the same dose of the vaccine. And its main reason to have is that it basically boosts your immune system and reminds it yet again of what COVID is, so that it can mount a response. Who can get the third dose of the vaccine? As it stands currently in Manitoba, these are the categories. So First Nations people living on reserves, people who've only received the AstraZeneca vaccine, which is no longer offered, healthcare personnel, people who are quite immunocompromised overall, individuals who have received one dose of a vaccine that's not approved in Canada, so vaccines that are available in like Russia, certain ones in India, as well as China, residents of care homes, and residents of First Nations care homes and their staff. What if you've had COVID-19? We discussed this previously as well. Should you still get the vaccine? The answer is yes, because obviously the vaccine provides you much broader coverage for the actual virus than just one infection does. Which one to get? Well, there's Pfizer and Moderna. Both are equally good. There's really no real difference between the two. But if you've received one already, that same one should ideally be given in subsequent doses. So if you received the Pfizer vaccine in dose 1 and dose 2, you should get the Pfizer vaccine for dose 3 and moving forward. If you've gotten the AstraZeneca vaccine in the past, then you should be getting either one of these doses in your subsequent doses. Where can you get it? It's an important point because originally you could only get them at certain super sites in the city. But now, because of availability and storage issues, they're available everywhere. They're available obviously still in the super sites, but also in pharmacies, medical clinics, even like my clinic, which has both the Moderna and the Pfizer doses. You can book appointments even now and get your doses as necessary, both in the daytime and in the evening. We do have doctors who speak both Punjabi and Hindi at the site, as it might be easier for language. Immunization cards is an important point. Once everyone's been fully immunized, they get the immunization card. Up here is the one I have. And the reason for it is that the card and the digital app provide a QR code, a code on the back that is scanned by places that let you know that this person's been fully vaccinated. And that's important to get entry into certain places like restaurants, bars, lounges, and eventually travel both inside and likely outside the province as well. People talk about vaccine exemptions. Who qualifies for a vaccine exemption? And the simple answer is pretty much nobody. Vaccine exemptions are for only a very, very small subset of the population who had a proven history and a reaction to the vaccine. And this is not just I had a rash, but a significant enough reaction that death is a possibility. Family doctors cannot provide this exemption. These exemptions only come from specialists, including hematologists, allergists, neurologists, and cardiologists, based on specific conditions that can happen either because of the virus or because of the vaccine and or other medical illnesses that you may have. Pregnancy. It's very important to get the COVID vaccine during pregnancy because there are no risks for fertility. There are no risks to the child. But if you don't get the vaccine and you do get COVID, it has significant risk to both the mother and the baby in terms of premature delivery. What about the flu vaccine and the COVID vaccine? You can actually get both together. There is no harm in that. You can get them in different arms, and some of the benefits of that is that you do get soreness in your arms, but the benefit is you've now been treated for both issues and you don't have 2 shots, just one. Or just 2 visits, just 1 visit. So vaccine hesitancy. We'll just talk about this real quick because I think that there are some fears out there. One of the bigger concerns has been illness from the actual vaccine. And like I mentioned before, you cannot get COVID-19 from the vaccine. And obviously it's to protect you from getting it. Long-term safety. It's been proven to be safe in long-term trials done over many years now, and it's been studied quite extensively. The effectiveness, not known. Some people are concerned that it's not been there long enough and they don't know how it will react. It's been clearly shown to be effective, both in real-world studies and in scientific studies. They talk about vaccines that won't target future strains. An important point to remember is that right now, the mRNA vaccines are a new technology and they're changing. Right now, the best information, the best technology we have are the mRNA vaccines, and hence, we should take them. Obviously, as COVID changes, we may have to adjust the vaccine to accept different strains and different types. but that is a future problem. Right now, we know what works and we should use it. COVID's going away anyway. This is a common misconception. COVID has been around for almost 2 years now, and there's no current end in sight. Obviously, we are much better along today to fight COVID-19 than we were in the past, but there is no clear end date in sight. As the virus itself mutates, and as more and more people get it, it could be with us for quite some time. But one of the main ways to get rid of it is vaccines and masking, because as mentioned before, vaccines and masking decrease the incidence of COVID, and eventually it will go away this way. Another problem is people are concerned about how the vaccine works in ethnic groups. There's currently no evidence that it is any less superior in any particular ethnic group. The vaccines themselves work equally well in all populations, whether they be from North America, from Asia, wherever. It works quite well across the board. Some people are concerned about government conspiracy that is forcing them to get the vaccine. An important point here is to remember vaccines like COVID-19 vaccines are like seatbelts. Everyone has seatbelts in their car, and everyone should wear the seatbelts in their car. Because an important point is, if you get into a car accident and you're not wearing your seatbelt, you'll have a very bad outcome. Everything from broken bones to cuts to even ICU stays and death from the injuries that can happen without wearing a seatbelt in a car crash. Vaccines are the same thing. If you have the vaccine and you get COVID-19, your chances of significant injury are significantly reduced. Last but not least, we talk about microchips, and there are no microchips inside the vaccine. How to convince people who haven't had the vaccine? An important point to mention is that we need to work together with people who haven't had the vaccine. Instead of ostracizing them or mitigating them to people who are unintelligent, it's important to recognize that they have specific concerns and questions, as we discussed just now. And it's important to have an open dialogue with those people. I'm sure you know people who are your friends in your community who are hesitant. And I think that the way to approach it is, like I mentioned, with the seatbelts. It's something that's easily relatable, understandable, and people can come across the benefits of seatbelts, just like they can with vaccines. It's an immune booster. So basically vaccines, all they do is they boost your immune system. That's it. It's not complicated, it's not fancy. It's a short-term boost for your immune system for the short-term problem that we have with COVID-19 currently. And as I mentioned, it will help end the pandemic. Last but not least, let's talk a little bit about how much of vaccine administration has been done in the world already. So far in the world, 6.84 billion doses have been administered overall, with an estimated population that's been fully vaccinated at approximately 2.92 billion, about 37% of the population. In India, unfortunately, it's taken a bit longer to get more people fully vaccinated, but even then, 21% have already been vaccinated. Canada is doing quite well, with the overall population being at 73.5% vaccinated as of yesterday. America is doing well, but not quite as well. So, in terms of safety and efficacy, it works. Lots of people have been vaccinated, 6.8 billion people, that's a lot of people. And in that, the adverse effects have been quite mild. The benefits have been greatly outweighing the risks overall, and we hope to continue that to get to 100% eventually. That's it for me. Next, we'll talk to Soubhik.
Okay. Thanks to the audience and thanks to Dr. Kumar and other speaker for a very comprehensive presentation on COVID-19. When we work in a pharmacy and a patient comes to the pharmacy, they have a number of questions regarding COVID-19 vaccination. But the most common questions we receive, what are the most common side effects of COVID-19 vaccination? And how the post-vaccination symptoms, like the side effects, can be managed? And the very third common question we received, is there any possible interaction between COVID-19 vaccine and the medications? Before going to the main part of the presentation, we hear so much about drug-drug interactions, like how a drug can increase or decrease the effect of another drug, that is drug-drug interactions. But there are so many other interactions can happen between drug and other interventions. Like a drug can interact with food, like grapefruit juice or grapefruit can interact with many medications, And not only between drug and food, it can happen also between drug and lifestyle interaction. And also there could be interaction between drug and disease state. So many interactions can happen, but it is beyond the scope of our today's discussion. In my presentation, I'll give a brief overview on post-COVID-19 vaccination side effects and how we can manage those side effects or symptoms. And is there any possible interactions between vaccine, that means COVID-19 vaccine and drug interactions? And my name is Kawshik Chowdhury. I've been working as a community pharmacist. And I also work as a director of preclinical research in a research company. It's called Amiya Limited. Before going to the main part of the presentation, it's important to know that this presentation is just for information. In terms of getting any clinical or regulatory information, like any kind of information for COVID-19, it's better to go to your physician, pharmacist, or regulatory authority. But today's presentation is just for information. Dr. Kumar and Dr. Maiti already explained how the mRNA vaccine works. It's a beautiful technology. It's not a science of today or yesterday, right? We know about the science, how mRNA works. If we look at the right panel about Moderna milestone, like the company was introduced or founded in 2010, and over the decade they did a number of research on mRNA technology for different type of interventions for therapeutic treatment, right? But it came in effect in 2019 and 2020 when COVID-19 vaccine was introduced. What I said, the science is beautiful. They introduced mRNA in lipid nanoparticle, and it is injected. When it is injected, it crosses the cell. It does not interact with the DNA material or genetic material, so it does not change the genetic code, but it can cause the translation of the mRNA to produce small peptide, which represents the spike protein of the COVID-19 vaccine. And the body reacts with this spike protein or this small peptide to produce antibody, and also it produces the immune response reaction with the T cell and B cell, which can work against COVID-19 disease. In the month of September 2021, Pfizer and Moderna, they introduced the new brand name, not the new brand name, it's the brand name for the COVID-19 vaccine. The Pfizer vaccine is known as Comirnaty, and the Moderna vaccine is known as Spikevax. So I'm going to, it's not the scary part, because it's according to the clinical trial. I collected the information from the product monograph of those vaccines. What could be the warning and precautions for a Comirnaty vaccine or Pfizer vaccine? Like, we should be careful, we can delay the vaccination if someone has acute severe febrile illness or high fever, right? Then the vaccination can be delayed to some extent. If someone has fainting, if someone has some allergic reactions, if we see on the list there are some certain ingredients in this vaccine formulation, top of the compounds like the cholesterol and other lipid things, they are used in the vaccine to produce the lipid nanoparticle, and the bottom part of the list, certain kind of salts and other ingredients which are added to the vaccine to make it isotonic, that means to compatible to the body fluid. Dr. Kumar already mentioned about this myocarditis and pericarditis. People can get myocarditis and pericarditis from COVID-19 active infection also, but it could be also a side effect of the COVID-19 vaccine. So if someone has predisposing condition with myocarditis or pericarditis, that means the inflammation of the heart membrane, then they should be cautious and they should discuss their condition with the physician. There is no fertility issues or hematological issues or immunological issues, but the fertility issue, in those clinical trials, pregnant women were not included. So there is no data, but theoretical point of view, and also in the with some practical data and practical application, these vaccines are pretty safe in pregnant women. Hematological means, if someone has any kind of blood clotting disorder, or if someone is on blood thinner, these vaccines are safe, but it's better to consult with your family physician. And immunological, it means, if someone is on some immunosuppressive medications or some cancer therapy, anti-cancer medications, then it's better to consult with the family physician. Adverse reactions, there are a list of adverse reactions they documented from the clinical trial. It can happen with any kind of vaccination. It can happen with flu vaccines. But just for record, injection site pain, it happened in the clinical trial in 84% of the population. Fatigue, headache, muscle pain, chills, joint pain, fever, injection site swelling, and injection site redness. Additional adverse reaction can happen in small group of population. It can cause nausea, malaise, that means tiredness, lymphadenopathy, that means swelling of the lymph node, asthenia, that means tiredness and loss of appetite, sweating, hyperhidrosis, and lethargy and night sweat. So most of the time, those symptoms are very minor, and it resolves over a day or two with or without any use of any over-the-counter medications. The special population, Dr. Kumar already mentioned about, and Dr. Maiti mentioned about pregnant women and breastfeeding. Those people are not included in the clinical trial, but these medications theoretically and practically they are pretty safe in pregnancy and breastfeeding. But it's also important to check with the family physician and the OB/GYN to see how to get the vaccination done during pregnancy and breastfeeding. The pediatric population, both the vaccines, mRNA vaccines, the Moderna and Pfizer vaccine, they can be used 12 years of age and older, but below the age of 12, the vaccine efficacy and safety is not studied. Geriatric population, in elderly population, 65 and older, these vaccines are used in this elderly population, so there is no question about the efficacy and safety of this medication in this population. So, side effects and adverse reactions are interchangeably used in some clinical literature, but there are little bit difference between them. But according to the clinical trial for community, that means the Pfizer vaccine, some side effects which are more common, it happened in more than 1 in 10 people, like injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, diarrhea. Just some other side effects happened in 1 in 100 people to 1 in 10 people. Those are injection site redness, nausea, vomiting, and there are some uncommon side effects like enlargement of the lymph node, feeling unwell, arm pain, and other symptoms like night sweating, excessive sweating, this kind of things. But what I said before, most of the symptoms they resolve within a couple of days. Spikevax is the vaccine, is the brand name for Moderna vaccine. The adverse reactions and the precautions and warning are pretty much the same as Pfizer vaccine. But according to their clinical trial, they found that there was a higher reported rate of solicited adverse reaction in younger group compared to the elderly population. And the side effects are more between the age of 18 to 64 compared to the age 65 and above because of the immune response, because we know that in elderly population the immune reaction or immune response go down compared to the younger population. And the solicited adverse reactions are more frequent after the second dose compared to the first dose. As we discussed before for the Pfizer vaccine, the special population, if someone is pregnant or planning to be pregnant, breastfeeding, it's better to check with the doctor first before getting vaccinated. But they're pretty safe in this population group. So the last part of the presentation, it is a very common question, whether this vaccine or any drugs can interact with this vaccine. What should be done and what should not? if someone is on a maintenance medication, that could not be the reason for delaying the COVID vaccination, because most of the medication does not interact with COVID vaccination. So COVID vaccination should be done as soon as possible if the group is eligible to get the COVID vaccination. And also the patients on blood thinner, some people could be on blood thinner medications. These vaccines are pretty compatible with the blood thinner medication, but it's better to check with the physicians. And there is no need to stop taking prescription medications or vitamin before getting vaccination or after vaccination. And it's all right to take Tylenol if there are some symptoms to relieve those symptoms after post-vaccination. But it's also important to keep in mind certain medications can decrease the body immune response, and therefore, it's important to check with the physician what can be done for vaccination scheduling. Because some people could be on high dose steroid medication, 20 milligram or more of prednisone, or like equivalent amount of steroid dose. In that case, the immune response to vaccine can be significantly decreased. So it's better to check with the doctor how the vaccination can be scheduled. Arthritis medication like methotrexate and azathioprine, they can decrease the immune response. And sometimes some biological immunosuppressant or immune modulator like monoclonal antibodies are used in certain conditions. So it is also a consideration, like how the vaccination can be done. And also another medication, like group of medications, chemotherapy, they can also decrease or suppress the immune response or immune induction system after vaccination. There are lots of controversies regarding whether anti-inflammatory medications can be used before or after vaccination. Anti-inflammatory vaccination, some people might say, okay, Tylenol is an anti-inflammatory medication. Maybe typically not. Tylenol is an analgesic and antipyretic because it suppresses pain, and it is used for fever management or fever control. That's why it is called antipyretic. But anti-inflammatory medications are mostly aspirin, Advil, Aleve, and other prescription medications which can suppress the inflammatory reaction. So there are some controversies, but it's better to not to take those anti-inflammatory medications before vaccination, and maybe sometimes after vaccination, because they can suppress the immune reaction and they can suppress the mechanism how these COVID vaccines are inducing the immune system to produce antibody. The last part of the presentation, Dr. Maiti already presented on which could be the vaccine exemption program. Most of the people, like it says here, Manitoba recommends that all eligible individuals who live, work, or study in Manitoba should be fully vaccinated. That's a must, right? And recommendation, strong recommendation. But there are certain group of people, you cannot vaccinate, or if you plan to vaccinate, it should be delayed to some extent because of the underlying conditions. There are lots of groups in this vaccine exemption program. If diagnosis of myocarditis or pericarditis within 7 days of mRNA COVID-19 vaccination, which is confirmed by a licensed cardiologist. Because we need a full vaccination to access the public facilities and other places, but some people cannot be vaccinated fully because of certain underlying conditions, right? People with Guillain-Barré syndrome, it's an autoimmune system, like autoimmune reaction, when your body produces antibody to damage the nerve cell. So if someone is diagnosed with this syndrome in last 42 days of COVID vaccination, then it should be confirmed with the licensed neurologist, and it can be postponed for certain period of time. And the delayed vaccination can be scheduled accordingly. And if someone is severely allergic to COVID-19 vaccine, then it should be confirmed with a licensed provincial medical officer of health, and they can submit it to DPIN, and they can submit to the medical the Manitoba Health to get a temporary card to access the facilities with these conditions. If someone has a confirmed, vaccine-induced immune thrombotic thrombocytopenia, it's a rare disorder. Some people could be, allergic to heparin kind of thing, and it can decrease the platelet count in the cell, and it can cause, different kind of problem, bleeding, and also I think sometimes leaking problem. That blood can be leaked through the blood vessel. If it is confirmed by a cancer care Manitoba hematologist, then the vaccination can be delayed. It most of the time happens with the AstraZeneca vaccine, but they can plan about the mRNA vaccination after discussion with the hematologist. And there are certain other conditions. I'm not going in details. The CRT therapy, stem cell transplant intervention or therapy, and solid organ transplantation in 2 weeks before or last month, within a month after the transplantation, it should be confirmed by the licensed specialist supervising the transplant, and it can be delayed, the vaccination. And also, if someone is on anti-cancer therapy, it should be consulted with the oncologist. And if someone is on some immunosuppressive medication, there are certain groups of immunosuppressive medications are used under certain conditions. It should be confirmed by the oncologist or hematologist or the licensed specialist prescribing the therapy. If more information is required for the COVID-19 vaccine medical exemption program, you can visit this website. It is available online. COVID-19 vaccine medical exemption program under Manitoba Health. So, what are the take-home messages from my presentation today? COVID-19 vaccines are highly effective, and it's pretty safe for active immunization to prevent severe acute respiratory syndrome associated with COVID-19 infection. The post-vaccination symptoms, what I listed before on the previous slides, the post-vaccination symptoms are mild and moderate, which resolve in 1 to 3 days. And COVID-19 mRNA vaccines do not interact with most of the maintenance medications and other vaccines, including flu shots. So before there was a guideline that when someone gets COVID-19 vaccine, 2 to 4 weeks before and 2 to 4 weeks after vaccination, other vaccines should not be administered. But with the new guidelines, we know that the vaccine can be administered at the same time, preferably on different arms, because there is a possibility if the COVID-19 vaccine and flu shot is administered on the same arm, there is a higher chance of lymphadenopathy or swelling of the lymph node. So in order to avoid this, it can be administered even on the same day but different arms. So that should be perfectly okay. And thanks for your attention. Thank you.
So that basically concludes our talk about COVID-19 vaccines. Now it's time for questions. Does anybody have any questions for anyone on the floor here?
People watching in Zoom, if you have any questions, you can go ahead at this time.
If not, we will adjourn. Oh, Amiya, you can't ask a question. You're the presenter.
Can I ask?
I'm not as smart as you.
I can ask. It's to Dr. Maiti yourself. Sure. The point has been touched upon but not replied completely, or I have not been able to understand. In my work, I also facilitate newcomers, and there was a hesitancy. There was one point that came up during some time that if I get vaccinated, will my chance of getting pregnant again is there, or it is little remote?
So-
Like fertility, they ask what about
Yeah,
that?
so there's no evidence that the COVID-19 vaccine or any vaccine will influence your fertility at all,
Okay.
because it's not related.
So,
It's
yeah.
completely different.
I just took that clip.
Yeah.
I will go and show them that this has been the expert's view,
Yeah.
and there is nothing about that
Yeah.
sort.
Yeah.
This isn't just our opinion. In fact, the Royal College of Obstetricians and Gynecologists in Canada and the American College of Obstetricians and Gynecologists in the United States and the British one have all said
Okay.
that it is perfectly safe in
Yeah.
terms of fertility for women,
Okay.
fertility for men, and in fact, is highly recommended. There is no evidence whatsoever there's any adverse effect for pregnant women,
Yeah.
and in fact, the vaccine is protective. You have a significant risk of having
Severe.
very severe disease if you are pregnant and become infected. And if you get the vaccine, the baby will get your protective antibodies. So it's just a good thing all around.
And you can also breastfeed the baby. Otherwise, if you're unvaccinated and have COVID at the same time you deliver, then the question is, how do you breastfeed? Because the baby is so near your,
Yep.
A woman who's immune, who's breastfeeding, she actually passes antibody on to her
Antibodies, yeah.
child.
Yeah.
So it protects the child even before the child can
Child is
get
born, yeah.
vaccinated.
Yeah.
And the idea, I just want to point out, the idea that vaccine has any effect on the mRNA vaccines, any effect on your own DNA or your own RNA. I want to point out that every time, if any people here are not vegetarians, for example, anytime you eat meat, you are ingesting foreign mRNA and foreign DNA, especially if you like your steaks rare. Even more so, every time you have a significant viral infection, you have viral mRNA circulating through your body. You get far higher levels of viral mRNA from natural COVID infection than you do from vaccination. So the idea that, somehow this mRNA is going to harm you, you're already getting it all the time from COVID and other viruses. So it's crazy.
And that brings a very good point. When you get hepatitis B infection, that viral DNA integrates with your own DNA. And we are talking about much sophisticated vaccine now without touching anything on your DNA, and people raising all these questions.
Oh, okay.
I think the DNA is in the nucleus, so there is no chance of getting that vaccine.
I don't know.
Sorry?
The DNA is located inside the nucleus of the cell,
Right.
so therefore no chance that the
There's
mRNA vaccine will
there's no
protect.
chance, but
Yeah.
even so, as I said, the fact of the matter is that we have foreign DNA and RNA circulating in our blood every time we get a serious infection. Any viral infection,
But
any
this was
infection
such
where
a
you get
new
chills.
information.
Right?
So thankful.
So yeah, the amount of mRNA that you have in these vaccines is 100 or 1,000 the amount that you get in these natural infections. So what are we worried about?
There's a question back there, yes.
Yeah, my question is a little bit silly question, but the question is like my first one was the Pfizer and second was the Moderna. And Soubhik, you were talking about the third doses, and I also read in the paper that third dose is already started. So for person like me, what would be the third doses? First one is Pfizer, second one is Moderna, and I know a couple of my friends, their first one is AstraZeneca, second one is Moderna. And I know a couple of friends, their first one is AstraZeneca, second one is Pfizer. So there are lots of combination, and I think it's only happening in Canada, because in India and other USA parts, I never heard that. So in Canada, they offer that, and so what would be your third dose?
So basically, either mRNA vaccine is good. So if you've been given the Moderna or the Pfizer, both are good. Whichever one you had last would be the easiest to get that one again, if it's available. If it's not available, if let's say tomorrow we don't have any more Pfizer vaccine because the factory shuts down, then you can get the Moderna vaccine and it'll be almost as good. I think because the research shows with one of the same vaccine, that's why we always suggest you stick with the same vaccine, but there's no difference in efficacy. If you've got the AstraZeneca first, then the Pfizer or the Moderna, either one is good. The next dose you get should ideally be the same one you got last of the mRNA vaccine.
The second one.
Yes.
But it doesn't matter if you get the first one. From a practical point of view, they all give you relatively similar immunity. There is some data that suggests that Moderna might give you a bit more and more persistence. The likely reason for that is that the Moderna vaccine uses 100 micrograms of vaccine. The Pfizer uses 30. So, you know, although you're right, the recommendation is to get one of the two that you've taken before, and probably the most recent one is reasonable. Like I said, the Moderna is a slightly higher dose, so if you like vaccines, that would be a reasonable way to go. That's what I did myself. I've already gotten the booster. The one thing if you don't mind, I'd like to tell you, to those who are listening who are not vaccinated, okay? I and Dr. Maiti and the others here, we probably know as much or more about vaccines as any other person in Manitoba. And I can tell you, I've already gotten my third dose. My wife has gotten her third dose. If you are an older person and you're eligible for the third dose, get the dose. There's always a risk with any vaccine that you can have an adverse effect, but the adverse effect of not getting the vaccine is so many-fold higher, it's not even a reasonable question. And as I said, if you check around the country, you will find that 99.9% of doctors have already gotten their 2 doses and are more than happy to get a further dose as well. And those are the people who know most of the time.
Thank you.
Sorry, I have a question. So, like flu shots, like will vaccinations, like what is the period, like ideal period we should get our follow-up vaccinations?
Your follow-up vaccination?
Yeah, like for COVID vaccinations, what is the like
You're talking
different
booster dose?
booster doses?
Okay. What's the like? What's the time?
So 6 months. 6 months.
So every
after
6
your
months
2
we should
doses,
get.
You should get the COVID vaccine, your booster dose. That's the current recommendation. Now, but like I said, only certain people are eligible for that booster shot right now. Dr. Kumar, as he mentioned, physicians and healthcare workers are, and I had a list of the people who are currently available for that, but the majority of people are currently not eligible for the third dose. I expect they will be soon.
They will be very, very soon. This is happening worldwide. In the States, they're probably going down to age 40 very soon. We'll be doing younger groups within 3 months or so.
And I think just to add, for the 6 months interval, only it is not applicable under certain conditions who people are immunosuppressed, and secondly who people are traveling. So if you have a traveling plan and it's less than 6 months, then you can go to your family physician and show your travel plan. You can get a prescription or get it the vaccination done in a pharmacy, or you can get it done by a physician.
Okay.
Or if someone is immunocompromised.
Thank you. That's a very good info.
Thank you, all of you.
Thank you, all of you.
No.
If there are no other questions, then I think we'll adjourn.
I think they mentioned about the vaccine clinic.
Yes, we did mention about the vaccine clinic.
Oh.
Like we are doing the vaccine clinic next week.
Yeah, so if people would like the vaccine, or if they're eligible for the booster shot in the criteria that's mentioned above, then I think that you can obviously go to, as Kawshik mentioned, pharmacies or other clinics, but my clinic, the Greencrest Clinic, is having available appointments in the daytime and in the evening for both the flu shot and the vaccine. In terms of the vaccine, we have both the Moderna and the Pfizer available, so either one is available to you. If people would like to do that, they can just go to the website, greencrestclinic.ca, and then just contact the clinic and make an appointment, and then go from there. And then obviously for the future as well, when there's new guidelines, we'll be able to give it at that time too.
No questions on Zoom?
Yeah, any other questions?
No questions. I'm asking again. Any other questions on Zoom from anyone?
Yes.
It's a question for everybody. I'd like to start with something that happened earlier this week. One, I have two concerns. One is I personally keep facing pregnant women who claim that they have been advised against being vaccinated by their OB-GYN. If maybe that was the norm a few months before when they were in their first trimester, and it has continued. They keep believing it. But if it is no longer the norm in Winnipeg or Manitoba now, should they be treated the same as the person who is refusing vaccination?
So to the point of an obstetrician gynecologist not recommending the vaccine, that is incorrect.
Okay.
The clear guidelines, as Dr. Kumar has said from the very beginning, has been that pregnant women should be immediately vaccinated. They should actually be at one of the highest categories of vaccination. The current SODC guidelines say that they are the equivalent of an 80-year-old in terms of their vaccination status, because their immune system is lowered because of the pregnancy, and hence, if they're not vaccinated and they get COVID, very serious outcomes can happen, both to the pregnant lady and the child. So no obstetrician gynecologist will say, do not get the vaccine.
Okay.
There's hesitancy from parents or pregnant women to get the vaccine because of Facebook and misinformation online. But no gynecologist or obstetrician will recommend that. And if that has happened, then they can always get the vaccine currently, no matter what stage they are within their pregnancy, anywhere from the first trimester to the delivery, or even after delivery. It's safe to have the vaccine, any dose of the vaccine.
Thank you.
That's the reason even the women's hospital, they have this kind of awareness program, and they're being administered there itself at their routine checkup, prenatal checkup.
Even before
before,
getting,
yeah.
you know, even before conceiving, they should get, so no matter
Yeah.
during,
Because the vaccine
after
protects
and before,
not only the
they
mom,
should get the
the
vaccine.
fetus as
Yeah.
well.
Your subsequent question?
The main problem we have today is the fear that the virus will mutate into something which our vaccines can't control. And that is more likely to happen in someone who has not been vaccinated, in populations, in places where large numbers have not been vaccinated. From that perspective, is it better in all, this is a question to all four of you, is it better that all 7 billion or so population be at least given the first dose, rather than concentrating on fully vaccinating and giving boosters to a select few?
Okay, so that was my question as well. Who should be vaccinated? Or there was a big debate whether we should give the booster dose or shall we vaccinate the whole globe, right? Again, I know there is a lot of, it's not medical indications or medical decisions, it's somewhat socio-political, right?
That's right. This is absolutely not a medical call. There's no, it's like valuing two people.
Absolutely.
Who do you value more, right? So yes, there's a theoretical risk that if you don't vaccinate the rest of the population, that there are a greater chance of variants to come. No question about that.
Africa, for example.
Africa is an excellent example.
No?
But that's fundamentally a social ethical question as opposed to a medical question. On an individual level, the people in this room are better off getting a third dose in terms of personal risk, right? There's no question you're better off in terms of personal risk to get a third dose of vaccine if you're elderly or you're otherwise eligible. On the other hand, the question of whether the whole world is better off getting everybody else vaccinated first, that's also no question about it. So it's how do you value the individual, your neighbors, your country, versus the rest of the world. And I don't know that any of us are qualified to make that decision.
Yeah.
Is that the advice the medical fraternity is giving to whoever supposed to decide?
Well, that's more of a political issue, I think. I think.
No, I know. But is that the advice the medical? Is there a duty of the medical fraternity to advise the political
Leadership.
I think
Leadership
the duty of the medical community is to speak the truth.
Yes.
And the simple truth is, again, on an individual level, you are better off getting a third dose. Because I don't have, as a physician, as an individual physician, I don't have my primary obligation to the rest of the world. As a single physician, I have a single patient in front of me, and my advice is to that single patient. So I would tell somebody who's in the right age group or in the risk group, you should get a booster dose. Now, if you ask me as a general consultant, what would be best on a global level, I would say everybody should get a dose. In fact, if you ask me, I think we should have a Marshall Plan. Marshall Plan was something that was put in place after the Second World War to rebuild Europe. They put tremendous resources to rebuilding the entire continent. If you ask me, we should have a Marshall Plan to basically just churn out vaccines so that everybody can be vaccinated within a year and a half to 2 years. That's what I think we should do on a global level.
My question wasn't from a socialistic point of view, actually. I'm concentrating on solely, say, on myself.
Yep.
That if there is a large population who is not vaccinated at all,
Yep.
and they manage to produce that mutant, it can come back to me.
It can, and that's a theoretical risk. And so far, the risk of a high resistant mutant is there, but it's relatively low.
Okay.
If you're talking in the immediate future, the better use of your vaccine on an individual level is for you to get a booster if you're eligible.
One last question, if I have the time. Earlier this week, I'd gone to my family physician, and amongst a few things, I'd asked him, because I'm over 60, whether I should take calcium supplements and in what dose, etc. And his reply was a straight, I don't know. I appreciated that. I appreciated your coming out with in answer to one of the questions from the floor, why Moderna is showing better results now than Pfizer in the long term. The problem we are having with the unvaccinated is there is a lot of fear, maybe unfounded fear, of conspiracy theories and misinformation, obviously. Where can I go for answers to questions? Where can I or the general public go for answers to such questions?
Well, what I can tell you is that no reputable medical scientist publishes in Facebook, right? So that's not the place to go.
I think in my view, this is best thing is scientific and medical literature is the best answer to get that.
All right, I'll give an example. When I have a 30-year-old son, and when he asked me, should he choose AstraZeneca versus the mRNA, well, he did take mRNA. Both the doses were mRNA, but I tried to find out how can I predict whether he's one of those it could be a very rare, a very small percentage who will go in for, develop myocarditis or pericarditis.
So I just want to point out one thing.
There is no indicator.
Yeah.
I can't tell him that go ask your family physician and have this test done.
What your family physician will say is the risk is so small that it's not worth trying to differentiate.
I understand, but here I'm not talking about N values or P values. I have one son, and I'm only concerned about him. even if it's 0.0001%.
So it's kind of like driving your car.
Yeah.
When you give your car to your son and he drives your car and he leaves the house, he's driving your car. He may get into an accident and he may die.
Yeah.
It could happen any day. He could drive home tonight and he could die. But the problem is, nobody knows. When everyone gets into their car and they start driving, nobody knows what will happen. But that's why seatbelts are important. Because if he gets into a car crash, his risk of dying from a car crash with a seatbelt on is significantly lower than if he didn't have a seatbelt on. And I think that's where vaccines are important, because vaccines are like your seatbelt. It's to help decrease your risk of having a problem. If you have a vaccine and you put that vaccine, if you get that vaccine in your body, just like a seatbelt, there could be risks to that. The risk is that you may have burns across your chest when those seatbelts are activated. So there's a risk of myocarditis. But there's no way to predict who will have that myocarditis or won't have that myocarditis.
Yeah, that's my precise thing. Like I said, the example I gave, the clear answer from my family physician that I don't know. When the answer is not known, that is never specified.
So I think the different things. I think that the issue of you brought up the calcium and stuff. So those are answers. That is defined actually. How much calcium you should take after the age of 65 is documented. It's 1,000 grams. So that is known. You should supplement after a certain age. But in terms of this, vaccines are good. Vaccines. I think that is there a possibility of myocarditis? In the world, there's a handful. So
I think the publication now, and New England Journal has published a few, mostly from Israel. Myocarditis in Israel has been, I think, if I remember the figures, it is a couple of percentage per 100,000.
That's right.
And most of them have been very mild. And I think in that big, mostly in Israel, army or others, and that involved, I think, one unfortunate death from myocarditis. But as we discussed, there is a risk of myocarditis, sudden cardiac arrhythmia from COVID itself.
Yeah, I think what you're asking is which vaccine is better. Is that what you're asking?
No, I'm asking where should I go for information?
Okay, information.
Where does the general public?
Yeah, so here's what I'd say. To take the driving analogy, okay? When you go driving, and the seatbelt is protected, you don't go and look into what kind of seatbelt is better, right? You don't look for literature. What you do is, the government puts out recommendations and guidelines for those seatbelts, and you trust that they're giving you accurate advice. In the same way, you go to the government sources, the Public Health Agency of Canada, and what they say right on their website is that there have been reports of this myocarditis associated with mRNA vaccines. Okay? If you have a concern, then get one of the other vaccines. It also says that the AstraZeneca vaccine for women of a certain age, 20 to 35, has increased risk of clotting. So maybe you want to take a different one. But the other thing they say on their website, right, on the official and government health agency websites, is that the risk of these things is so infinitesimally small, even with these vaccines, compared to what your risk is of the same condition if you get infected, that you are far better off taking the vaccine, even if it's the one that has some small risk associated with it, than not taking the vaccine. And that's right on the website. So go to the reliable government health websites. Public Health Agency of Canada, American CDC, the British have a similar website, and you can get all the consensus information there. And if you don't like doing that, talk to your family doctor. That's like going to the government. He may not know all the details, or she may not know all the details, but they'll know enough to get you through.
I just wanted to share something here. We forgot to mention in the Greencrest Clinic, like anybody who would look out for a vaccine, if they are having trouble with the transportation, we have availability. Like we can reimburse the transportation if one is looking for it. Go get your vaccine and submit your receipt to Sanskriti Winnipeg, and it will be covered.
Okay.
And the other thing is, the very reason why we are setting up this outreach event was we have, as Sanskriti, We have 100% vaccination. We just tallied that yesterday, and we had a thank you event done. Now we are reaching out to the greater, outside our organization, to the other community people around that are still hesitant. What I'd like to just say is that we have got people action based on science and community. All our events throughout have been, we have embedded vaccination outreach in all our festivals and events throughout the later part of this year. And also, second thing is we have followed a science-based approach. So as Dr. Kumar has said, Facebook is not the place to look for scientific answers. We have got the people that are best in Manitoba, like ER physicians, family physicians, pharmacologists, who deal with people, deal with the questions. You have seen the things. I would recommend as a layman to look out for answers in this type of seminars. And this session is getting recorded, so you can, even if you're not able to attend live, you can always go back and look for your answers. And we'll be happy to help you through our organization. Thank you.
All right, thank you.
Same thing, one of the questions we were asked when Moderna didn't come, Pfizer and Astra were the only vaccination. Which one to take? Any vaccine is good, better than
We are closing the Zoom session now.
One more. Yes, thank you.
Thank you. It was nice. It was really informative, and I didn't fill out all the things.
There was a question. Threshold for
We are stopping our live now. Thank you.